So I would like to take a moment to introduce our for today. Excited to have with us Dr. Sophie Lebel. So Dr. Sophie is a professor at the University of Ottawa School of Psychology. She is a clinical health psychologist with a PhD from the University of Montreal in Quebec. She is also the director of the Interdisciplinary Psychosocial Oncology Research Group and Laboratory, an initiative that brings together researchers, healthcare providers, community partners, and trainees with an interest in helping cancer patients and their loved ones in the Greater Ottawa region. Her research interests focus on cancer survivors and their families, with a focus on developing and testing questionnaires, models, and intervention for fear of cancer recurrence, sexuality, fatigue, stigma, and dyadic adjustment. So without further ado, I'm very excited to pass it over to you, Sophie, for our presentation today.
All right. Thank you very much. And hello, everyone. It's really a pleasure and honor to be here with you today to talk about fear of cancer recurrence. I hope you can all hear me well. As mentioned, I'll be happy to answer as many questions as possible. So I'm hoping to spend about 40 minutes talking to you about fear of cancer recurrence, and then to have lots of time for questions and discussion. What I'm hoping to do is sort of introduce the topic of fear of cancer recurrence, talk about what normal fear of cancer recurrence looks like versus fear of cancer recurrence that might be more problematic, and then talk about fear of cancer recurrence in the context of COVID-19. Certainly things have changed, as we know, in the past year, and how I think this might have an impact on fear of cancer recurrence. And then I want to spend the last portion of the talk to think and review some of the things you can do to help yourselves manage that fear. All right, so let's get started. So first slide. What is fear of cancer recurrence, and how common is it for people with cancer and their caregivers, family members, to experience it? So first, let's see what I define as fear of cancer recurrence. So fear of cancer recurrence for me is the fear, worry, or concern relating to the possibility that the cancer will come back or progress. So there's a few things that are important in this definition that researchers have agreed on. First of all is the choice of words fear, worry, or concern, indicating that this is oftentimes a very realistic concern. You've been told certain statistics, you know your risks, and it's normal that you'll have occasional concerns about the fact that your cancer could come back if right now you're with no evidence of disease, or if you have a cancer that is ongoing, you may be concerned that your cancer will progress and take a downturn for the worse. Fear of cancer recurrence, when we ask people to list some of their concerns, usually comes up on top as the top in the top 3 concerns that cancer patients and cancer survivors have. So it's what we call an unmet need. An unmet need is a psychological concern or physical concern that you have as a cancer survivor, that your family members have, and that is not being addressed by the medical system. So many cancer patients have this fear, but few know how to have conversations about it with their oncology team or their family physician, and few know where to seek help for it. So one of the questions we were wondering is, how common is this? So it depends how you ask the question. So in studies, if we simply ask the question, have you ever thought about the possibility that your cancer will come back? I'm sure if I were to ask you this question right now, most of you would say, yes, I have thought about the possibility that cancer will come back. So if I simply ask, have you ever thought about the fact that your cancer could come back? Sometimes 98% of people will say yes. So it's very common if I just ask you, have you thought about this in the past? When we start sort of putting numbers onto things and quantifying how much you're reporting this fear, we find that 1 cancer patient out of 2 reports at least what we call moderate levels of fear of cancer occurrence. So moderate to high fear, which for me as a clinical psychologist would ring a little bell that it's time to take a closer look at what is happening with your fear. So that's a high number. So one cancer patient out of two will experience a level of fear that is at least indicative that something should be done, or we should be having a conversation with you about your fear. I don't know if there are many caregivers in the audience, and I wish we could meet in person, but if there are caregivers here, know that fear of cancer recurrence, so the fear that the loved one you have with cancer could have recurrence, is extremely common. So we find that fear of cancer recurrence is just as prevalent in family caregivers as it is in patients. So all this to highlight what's at the bottom here. One of my first take-home messages for you is that fear of cancer recurrence is a very, very common experience of cancer patients and their caregivers. And then there's a range of this experience. So it varies from what I call normal to what we call clinical or excessive fear. And I'm going to talk about what normal looks like and what excessive looks like. But normal for me would be somebody that a few times a year, when let's say they go back to the cancer center, when we were doing an in-person visit at the cancer center, or I guess when you have a telemedicine appointment with your team, you go for your scans, your appointments, your exams, and then you meet with your oncologist. During that period of time, you might be experiencing some anxiety and wonder, well, what if, or I wonder what my results will show. And then, you meet with your oncologist, things are fine, and your level of anxiety just goes back to what it was before. And this may happen to you a few times a year, but in general, you're like, in between those times, you find you're managing well. And even while you're waiting for your results, you're okay. It's difficult, but you're managing. So that's what I would call normal. By the way, some people never say that they really don't worry much about fear of cancer recurrence. And so that does happen too. So if it's not something you find you're preoccupied with, know that that's also a normal reaction. Now we're going to talk about what it means when you have excessive fear. So what does that look like? So how do I know if my fear is normal or excessive? So just like when you go see a primary care, your primary care provider, he or she will be asking you for symptoms and will be checking things. So I've put this little thermometer to know how much fear are you experiencing here. Are you in this blue zone where you're okay, or are you hitting the red zone where this is an issue? So these are the symptoms that I would be looking for if I was talking with you, to know how much of this fear. How much of this fear are you having, and is this starting to be an issue? So I'm just raising this up for you as something to think about. If you feel like, you're endorsing some of these, you're not sure, might be, you could take this with you as you need to have a conversation with a member of your team and see if you need help. We will be talking about some things you can do to help yourself as well. So in the past 3 months, and this is important because I'm looking for something consistent. So not, as I said, not a one-off, or you have an occasional thought, that comes and goes, but something pretty consistent that's been there with you for at least 3 months. So in the past 3 months, you are having intrusive thoughts. So thoughts that you can't push away, they keep on sort of intruding on your mind, or you're having images as well. So you're seeing yourself, flashbacks of you during treatments, or you have worries of what if this happens, then oh my gosh, what's going to happen to our house? How would I tell the kids? So you're having these thoughts, and you're having them pretty consistently, and you find them hard to control. Okay, that's a key thing. People who have more normal fear feel that, okay, I can manage, but when you start getting into excessive fear that's a problem for you, you find it hard to control your thoughts. As mentioned, you find that these worries, these thoughts, these images, you're having them most days than not, and not just around, those predictable times of your appointments, your test results. Another sign that I would look for is you being repeatedly concerned that sensations in your body mean that your cancer has come back. So that could be a headache that you've had since yesterday. It could be a new ache or pain. Something is happening in your body, and your mind immediately goes to, oh my God, the cancer has come back. Okay. As I said, it's normal that you'll have an occasional thought around this, But if this is persistent and it's happening most of the time that you have a symptom on a regular basis, this could be an indicator that fear of cancer recurrence is a problem for you. Here are the last two that I'd be looking at. I've worked with many patients who spend too much time looking for reassurance. So it could be asking for additional imaging, asking for additional appointments to be reassured, just in case, I'd like to have this extra scan just to be sure. Or I've spent time, I've helped many people who are spending too much time online, I meant on the internet or online, researching treatment options, going to different web pages that explain symptoms and then what could happen on various treatments. And they're spending sometimes hours a day. So if you find that and you know yourself, so sometimes you start looking at something, you get a bit of information and you keep on clicking, and this causes you anxiety. So if you're finding yourself asking for too much of that reassurance and spending too much time online, this might be another cue that you need help with this. And simply you find that your day-to-day life is impacted. Let's say your relationships with your family members, your spouse is impacted because of your fear. Your ability to go back to work or to work is impacted. You're not meeting people as much before COVID. You are not engaging in your normal hobbies. You find that, you can't plan for the future. That's a common one. People tell us, I can't plan for a trip. I can't plan to buy clothes. I can't plan for these things that I would like to plan for because I don't know if my cancer is going to come back. All right. So these are some of the signs to keep in mind, and we'll talk about some solutions. Another question I get often is, do we know who is more likely to struggle with fear of cancer recurrence, especially like these high levels of fear of cancer recurrence? And there's actually quite a bit of research on this. So yes, for the following people, women, so patients who identify as women, younger patients, let's say usually younger than 50, younger patients or younger caregivers are more likely to report fear of cancer recurrence, as well as having many physical side effects, either of the cancer or the medication you're on. The way we understand this is if you're experiencing many of these aches and pains because of whatever medication or treatments you've had, you're more likely to worry that these symptoms, these things in your body mean cancer has come back. So that's more likely to trigger you. Know for the following things that people often think will be a risk factor. So the treatments you've had have little impact on fear of cancer occurrence. So we find very few differences between people who've had radiation versus chemotherapy versus a combination. That doesn't really seem to have an impact. Nor does it time since your diagnosis, with many people thinking and sometimes hoping that as time goes by, this fear will go away on its own. So that could happen to you, but in general, most research finds that it's a pretty flat line here. If you have fear of cancer occurrence during your treatments and after you've completed treatment, chances are that fear will stay with you, although some people do see a decrease, but in general, you're not going to see a lot of change with passing of time. And a question I often get also from medical professionals is, what about the actual risk of recurrence? So we know that not all cancers are the same, and even within the same site, so let's say breast cancer or prostate, colorectal, lung, any cancer, there'll be wide variation in the actual risk of recurrence depending on many factors like the stage of disease, the subtype of cancer you've had. So your actual risk of recurrence and your survival rates will vary a lot from person to person. And many people, including medical professionals, think that your actual risk is going to be a good predictor of your fear of cancer occurrence. That is, if you're at high risk, you have predictably a higher fear of cancer recurrence, as if it was like an even scale. Well, it's not. So many studies have found that it's not because you have a greater chance of having an actual recurrence, that you're more likely to have a high fear. On the contrary, what seems to matter is what you perceive your risk to be. And that could be based on many things. It could be based on your family history, on previous experiences. It could be based on what you understood, on your personality. So many factors will come into how you perceive your own risk to be. So, for example, I've worked with many women with breast cancer who, on paper, their objective risk of having a recurrence was quite low, let's say in the 10 to 15% range. So that's what their oncologist told them. That's what the research shows. Their actual risk was about 10, 15%. But they would look at me and say, Sophie, I'm 100% convinced that I'm going to get a cancer recurrence. It doesn't matter what anyone says. I know it's just a matter of time and I'm going to have a recurrence. So that's the difference between the actual risk, which was 10 to 15%, and their perceived risk, what they thought was their own risk, which can go up to 100%. And not surprisingly, for people who think that their chances is 100%, those are people who are going to have a high fear of cancer recurrence. So it's your perceived risk that drives your fear of cancer recurrence, not so much the number you're told. Keep this in mind because we're going to relate this to the context of COVID-19, and I would love to hear your thoughts and comments about that later on. So hold on to that notion that it's your perceived risk that's going to drive your fear of cancer recurrence. All right, so let's talk about COVID-19 and what impact it's having on you and on fear of cancer recurrence. So if as a scientist, I'm asked, what impact is COVID-19 having on patients' fear of cancer recurrence? This is what my answer is going to be. We don't know yet. We have to do research about this. So people are researching the impact that COVID-19 is having on cancer survivors, but we don't have a good answer yet about what's happening to fear of cancer recurrence. Is it the same in patients? Is it changing for the better, for the worse? We currently don't know. But we do know, so studies from all over the world are showing that cancer patients are reporting increased feelings of anxiety. I guess many people are reporting increased feelings of anxiety, and cancer patients are also reporting these feelings of anxiety. And also what I hear from a lot of patients, feelings of isolation. Okay? So we know that there's increased psychological stressors on cancer patients and on their caregivers. And why might that be? Well, cancer patients are repeatedly told in the media and maybe by their oncologists. And again, this depends on your particular type of cancer. But there's a lot of media information saying that some cancer patients are a vulnerable medical group. And this could be due to your disease. So I work, let's say, with lung cancer patients. So their disease site, the lung, puts them at greater risk. It could be some of your treatments if currently you're immunocompromised. But of course, that's not the case for everyone. And then there's the fact that cancer in general is a disease that increases with age. So that the majority of cancer patients are older adults, and we know that being older is a risk of greater complications from COVID-19. So overall, some cancer patients may consider themselves to be a more vulnerable group to this disease. And then I don't know about you, but I hear this a lot in the media and in I guess some of the scientists I follow online, some of the news. We're hearing a lot about delays in getting diagnosis, delays in getting treatments, appointments, imaging, scans. We're hearing that cancer patients have not been diagnosed at the same rate. So I'm wondering, is it that people are not seeking help? So we're wondering, what are those delays going to result in terms of the medical impact on cancer patients? Again, we don't know exactly what the impact of these delays are going to be on the health outcomes of cancer patients, but we hear about this, and we hear about changes in the way the care is delivered. And this, of course, may create anxiety, frustrations, many different feelings in cancer patients. We also know that the context of COVID-19 means that in-person visits at the oncology center or with your primary care provider have often been replaced by telemedicine appointments, either via phone or via some sort of platform like Zoom. What I wonder is, does that mean less social support for cancer patients? Often, patients would tell me that they would chat with other cancer survivors, that sometimes they would see the same people when they went for their radiation therapy or their chemotherapy, that they would see some familiar volunteers, other patients, and then that you would chat more with a member of your oncology team. I wonder, does that mean that you're perceiving less social support from other cancer patients, less support or access to your healthcare specialist? Of course, there's less social, sometimes there's less access to support in general, where most of us are home. We are told to just stay within our own household, so this decreases the opportunity for you to receive some of the support you need. So I wonder if all of these things together may lead some patients to feel like their risk of having a recurrence is greater because they're not getting the same kind of care than they would before, because they may be at greater risk for complications of COVID-19, or if you've experienced delays in getting appointments or results or all kinds of things. In my clinical work, what I found is that the people I would help with their fear of cancer recurrence, those that were quote unquote disappointed by the medical system, felt let down, had hiccups, and sometimes really real hiccups. They fell through the cracks, something happened. Those were people who then became less trusting of the medical system because they had a bad experience. And sometimes it felt to me like that fed into their fear of cancer recurrence because they felt, well, if something happens, they're not as sure that they'll be taken care of as they should. So all the current context makes me wonder if people are going to feel at greater risk, and if that means that people will have greater fear. And I would love to hear your comments about this in the question period. But again, we don't know yet what impact this is going to have long term and how to best help patients at this point. So it's an ongoing story. Now, I want to spend a good sort of 15-20 minutes here to talk about what you can do to manage your fear, which you're probably all wondering about. So there's many things that you can do. And by the way, there are excellent treatments out there, and we'll talk about that. But there's many simple things you can do. So for this, the first three here apply for anyone. So whether you have low level fears or just occasional fears, or if you have those more, if you're really struggling with your fear of cancer recurrence. So I would say if you're a patient or caregiver, whether you're the one talking or you're the one listening, really take the time to normalize for for yourselves and for others, normalize these fears. These are, as I said, really common fears. They're normal fears. Often, I think cancer survivors are told to think positive, not to worry about anything. It's impossible, as you know, to think positive all the time. It's normal to have these thoughts, and we'll talk about, should you be able to control these thoughts, and I'll try to dispel that myth. So normalize that these fears from time to time are going to happen. Know yourselves. Know that probably, like everyone else, you have triggers. So if you identify with the scenario I mentioned earlier of going to the cancer center and being like, oh gosh, during that week or two where you're waiting for your results, you know that you're going, to have this increase in anxiety. This is predictable. You've gone through this a few times. You know that next time you go back to the cancer center for the same follow-up visit, that you're going to get this anxiety again. So, try to manage your time, try to plan to schedule pleasant activities, have your social support with you, talk about it, distract yourself with something healthy. Know that these will be bumps in the road and you'll have to manage them. Find people that you can talk to about this that won't try to shut you down by saying, but that's all in the past. When I've done therapy with people with fear of cancer recurrence, people who came to our fear of cancer recurrence groups often mention that their family members would be like, oh, but it's time to move on. They wanted the patient to put the experience in the past, sort of not really talk about it. They felt like it was almost like dwelling on it. So let's not really talk about this. It's in the past. You look well, you look great, and let's just move on. So find people that will take the time to listen to you and won't like rush you or try to shush you about your fear. If you're the one listening, just listen to the experience. I think my best advice would be just go with where the patient wants to go, and just don't pressure them to talk too much or too little. Just try to be a supportive listener and understand that this is a difficult, it's a frightening experience, and it's normal, and doesn't mean that you're weak because you're having these thoughts. Just try to be there and support. If that's not accessible to you, that your family doesn't really want to go there with you, then I would say look for a support group. I mean, you're here with Wellspring, so imagine that you're already doing this, but other cancer patients can probably relate to your experience. I would say that was one of the greatest benefits that participants in our fear of cancer recurrence groups found is, oh, I'm not the only one who worries about fear of cancer recurrence. Other people are having this fear. I'm normal. I'm not crazy. Now, when you do experience this fear, which will happen, it's important that you engage in good self-care. And self-care will mean many different things to many people. But I would, again, encourage you to follow the guidelines for physical activity for cancer patients, the guidelines around good nutrition, to get good sleep, all that sort of basics stuff, to engage in some sort of relaxation, meditation, yoga, mindfulness, something that helps you, engaging in pleasant activities, whether that's gardening, painting, cooking, whatever you find, sort of replenishing for you. Other forms of self-care that I think have a bit of evidence out there is just, for example, something like doing a gratitude journal. So writing things that you're grateful for would be helpful. Writing down some of your fears and a diary could also be a helpful way of coping with this. So don't neglect to take time for your self-care, especially I find now during the time of COVID, where this extra layer of anxiety around all of us. The last point might be difficult for some of you, especially if you're feeling anxious and you tend to more like avoid getting medical information. Like some people really want to know everything, and these are the people that are spending hours online. But then you have the flip side, and you have some people who would rather not know. So I've worked with many cancer survivors who are like, and I would ask them, so do you know what your objective risk is? Have you asked questions to your medical team about what this means? And the answer is no. So I've worked with many people who've never asked questions about their particular cancer type or prognosis or what this all means. So then they're even more fearful because they don't know what they're facing with. So when you're facing an unknown, sometimes your mind gets the better of you, and it becomes a worse thing than what it is. So I usually encourage people to gently encourage people to look for appropriate medical information from your team. I know that's not always easy, that healthcare professionals often are very busy, but if you can prepare ahead of time some questions and go over some of the basics with a member of your medical team, and that could be things like, what are the signs and symptoms of recurrence? What should I be watching for? What are some things that maybe I shouldn't be worrying about? And what are some things that I should actually be telling you about? Who should I be reporting these signs to, right? So who's the right person to contact in the organization? How do I get a hold of them? what should my follow-up care look like? What are some of the things I can do that are based in science to prevent the cancer from coming back? So we know, for example, that exercise, for many cancer patients, many cancer types, shown to be an effective way of reducing the risk. So you could be, asking some of these questions about risks and symptoms and what to actually focus your attention on. And there's a reason for this. There's a reason I encourage people to do this. I'll give you a little anecdote from my practice with people with fear of cancer recurrence. I once helped a really lovely, lovely woman with breast cancer who was highly anxious. And because she was highly anxious, she was always sort of scanning online for new information. And with every ache and pain she felt, she was concerned that her cancer had come back. She came to see me and she was 1 week really, really concerned that her breast cancer had metastasized to her liver. And she was convinced, and she was feeling, you can't really see me here on camera, but she was pressing, below her rib cage and sort of pressing and said, I feel something here. There's something, I know it. I really think it's the cancer has come back. And she would get her husband to sort of press also and feel her abdomen. And by the way, guys, if you press your abdomen for, repeatedly over several days, eventually it's going to feel a little sore from just your pressing. But anywho, so she was pressing and really convinced that cancer had come back until eventually through some of her online research, she actually realized based on like diagrams that she saw that the liver was actually on the other side of her body. And whatever she was feeling there was certainly not her liver because her liver was not there. So that's what I mean. Sometimes if we don't have the information or we're unclear about what to look for, we're more likely to think that these aches and pains mean that the cancer has come back. So ask your medical team for the signs that you should be concerned about versus those, and how long you should be having those signs and symptoms before you actually are concerned and report them. Okay, so let's move on to some other things you can do. So for people now who have, fear of cancer recurrence that's starting to be a bit more excessive or high, you're finding that this is something that's sort of a weekly or daily, occurrence in your life. I would say, so now would be a good idea to try to achieve a balance and look at the way you're coping with your fear. So I would say now might be time to sort of decrease that, what we call that reassurance seeking. So asking yourself, okay, do I really need to ask for an extra test? I had people that met with their family physicians once every 2 weeks. It was mostly for that support. Is that needed? Do you have enough information, or are you really gaining more by spending more time online? So to question that and then try to decrease the amount of time you spend online, or at least choosing sites that don't create more anxiety. Or sort of decrease. On the other side is people who avoid too much. So I've worked with many, many patients whose main way of coping with their fear was to keep themselves very, very, very busy. So they told me that they had a packed agenda with activities, people to see, and that somehow being very, very busy meant that they sort of were keeping those thoughts of the cancer coming back away from them until it was time for bed and it was nighttime. And then they had nothing to keep them busy and distracted. And that's when they felt like all the thoughts were coming back and having an impact on their sleep. So I would say it would be important to take small steps into sort of staying with the fear. So instead of really trying to push them away all the time, to sort of say, okay, I need to just let those thoughts come a little closer and see, what am I afraid of? So I call it sort of taking small steps to opening up that sort of scary box and just sort of processing your experience. What have you gone through? What are you afraid of? Can you talk about it with someone? Can you write about it? Which makes it eventually less scary. And you might need professional help if this is really, really distressing for you, in terms of opening that box in a safe environment. Acceptance is a big one in many studies. It's just sort of accepting that's where you are today, accepting that there are unknowns, accepting that you're doing the best that you can to manage this anxiety, accepting that this is the reality, and that you might now be living with some limitations, that your life might be different. and that accepting that sometimes you'll have these moments of fear, but that, these too shall pass is an important thing to remember, that this moment of anxiety, this fear that you have, is going to pass. And that sometimes the best thing to do is not to fight those thoughts, but just let them be. And we're going to do what I call the pink elephant exercise together. So I want you to, when I say go, we'll spend about 30 seconds. And during those 30 seconds, I want you to close your eyes if you feel comfortable doing so, and to block all thoughts of pink elephants from entering your mind. All right? So on the count of three, 1, 2, 3, go. Close your eyes, and for the next 30 seconds, block all thoughts or images of pink elephants from your mind. And really, really try hard now to control your thoughts and push away any thoughts or images. And if we were in person, I would ask you to raise your hand the moment something pops into your mind. So you've got 15 seconds. Keep trying harder. Push away those thoughts. Block those thoughts. Do a little bit. Yeah, keep going. 5 more seconds and stop. So we did 30 seconds. I'd be really curious to know how many of you manage not to see an elephant, or if, on the contrary, this was your experience. The more you tried to push away these thoughts, the more elephants you saw. And research would show that that's actually what happens. The more you try to push away thoughts, to do what we call suppress your thoughts, the more they're going to pop up. So if people tell you, just try harder not to think about this, you just need to be stronger. Actually, it's the opposite. You need to just let the thoughts sort of walk through and leave on their own. The more you try to squish them, the more they're just going to pop up and multiply. When I do this exercise, I usually get, a few people who are like, you know what, I managed to ban all thoughts or images of elephants. And I say, oh, how do you do that? And they said, well, I focus on something else really, really hard for those 30 seconds. So like I imagined my cottage, or I thought about this meal I'm going to make. And I really went through all the steps and I really, really focused. I said, okay, wow, that's pretty great. Do you think you could do that for like more than 30 seconds? Could you do that for hours? Could you do that all day long? Could you do that for days on end? Because that's what you need to keep all those thoughts of fear of cancer recurrence away. And then they realize, of course, you can't sustain that. It might work for 30 seconds, but not longer. So the idea is really it's hard. It sounds like very contradictory, but I'm saying, don't try to push those thoughts. Just try to let them be. And over time, they become less scary. We're going to wrap up with a couple more slides. So remember that there were probably occasions in your life where you manage uncertain times. So a recurrence is a very uncertain event. Will you have a recurrence? Maybe, maybe not. When? Who knows? There could be other things happening. It's a big, big unknown, and many of us would like to know exactly what's going to happen and when, but it's not possible with cancer and recurrence. But you've probably managed other unknown times, or let's say it was finishing your education and starting a career, or changing careers, or starting in your relationships, transitioning to retirement, transitioning to parenthood. So you've gone through many unknowns. It could be a different disease. And probably you've had some success in managing this unknown. So remember what helped you then, and sort of try to pull that in for managing your fear of cancer recurrence. Another important one that I find a lot of my patients struggle with is kindness. Kindness towards yourself. So the way sometimes we talk to ourselves is something along the lines of, oh my gosh, Betty, just pick up your pants, be a big girl, just slap yourself, and just, get a grip, get a hold of yourself, put on your big pants and big girl pants, and just move on. And I say to Betty, what would you tell your best friend if she was going through the same scenario? And Betty's like, I would never tell her that, of course. So sometimes we talk to ourselves in a much harsher way, I think, to try to get ourselves out of something, when in fact what we probably need is a little bit of more kindness. And the point of this talk is not to tell you to never think about fear of cancer recurrence, to never be worried, my point is that it's normal to be worried, it's normal to have concerns, and that what I want you to think about is to question, what might be like a good enough amount of worry for you? An amount of worry that you, and it will be different for all of you in the chat, in the room here, the virtual room, all of you will be comfortable with a different degree of worry. But we want you to be at least thinking about your health. We want you to worry about or be mindful of symptoms, be mindful of your appointments, ask questions, be engaged with your treatment and your team. So that might be what we call enough. But certainly you don't need to worry about this every day. And to try to strike a balance where you think, you know what, I've spent enough time researching this online, or, you know, I'll cross that bridge when I get there. Sort of strike a balance between and question, do you really need to spend all this time or energy on this? And I can address your questions about this. And last, I'll leave you with a good news for those of you that might be thinking about, I wonder if there are any professional mental health professionals that can help me out there. There's really good evidence that's come out in the past, I would say, sort of three years, that there are really excellent brief treatments that work out there. Usually we're talking about like 6-7 sessions of therapy, either one-on-one with a mental health professional, or in groups, so in a group setting, where what we call cognitive behavioral therapy, so paying attention to your thoughts, learning new skills, or mind-body interventions. So people who might be familiar here with mindfulness, there's good evidence that these treatments will be helpful to manage fear of cancer recurrence. So that's my take-home point before we go into questions. Fear of cancer recurrence is common. It can range in its severity. There are many things you can do in your day-to-day life to help yourselves. And the goal here is to achieve a place where you are comfortable and you feel like, you know, you can cope with this fear. The goal is not for you to get rid of this fear, because it's normal that you'll have some fear, but the goal is for you to feel like you've got a sense of control and you've got tools to manage your fear. All right, so let's leave it here.